and welcome to Health, Hospitals, and Social Services Committee.
A minute early.
A minute early, yes.
A minute early.
A minute early.
Just saying.
So it's great to see Councilmember Glover back with us today. Councilmember Glover, glad to have you back. Yeah. So we have, before we dive into our agenda, I wanted to invite Dr. Gill from Metro Public Health to come and give us a COVID update. So Dr. Gill, the floor is yours.
Thank you. So I've also been asked to give, so you'll get to hear this a second time because the council as a whole is there. But wanted to just kind of give you a little update on what's going on. Today or tomorrow when it comes out, we'll report another 565 new cases. This will bring us to about 2,700 active cases. This is the first time we've been to that point since late January or clear back in early October of 2000. So things are heating up. We've currently gone up to about 190 new cases per day right now. And that's lagging a little bit because if you take the 565, that's really almost 265, I think, that we actually increased. But that's a 7-day average, so it's going to trail a little bit. Obviously, we continue to do as much as we can to get people vaccinated. We've had our strike team out. We've now done 375 plus events, vaccinated almost 22,000 people at those events. So we're doing as much as we can and offering as every place that we can. The drive-through at Murfreesboro Pike is still open. Can do testing and vaccinating there. So and we just had a discussion. The OEM and us had a discussion. They're going to continue that site through at least the end of the year now. We had talked earlier about maybe being able to close it at the end of August, but obviously with what things are happening now, that's probably not a
What
good
about
idea.
Meharry?
Meharry, actually it's because they can do testing individually, but we're not going to have that site because they've got a huge construction project going on. And Dr. Hildreth asked us, that was the first one we got rid of because it was going to interfere with all their construction plans. So we don't want to do that. They're actually going to be continuing to man the Murfreesboro Pike. And we want to continue with that partnership because they've been great. They just absolutely are wonderful to work with, and they're wonderful, caring people that deal with the public, and it's just really been a good experience there. So yes, we don't want to change that relationship at all. So as of Monday, just about 48.4% is what the state says this morning have been vaccinated or fully vaccinated here in Davidson County. So just under half. And just a little over 53% have received at least one dose. So we're doing okay, but we got a long ways to go if we're looking at 70, 75%. So we're also being involved. I was down talking to the mayor earlier about masking or not masking a building, metro buildings, and some issues he had. And we'll be there's a special meeting of the school board on Thursday that we'll also be present at. Myself and Leslie Waller, who's one of my epidemiologists, are going to go to that meeting. So we continue to give as much information and provide that. But at this point, at least for the adult population, public health is do everything you can to mitigate all the risks you can up until the point you have a valid prevention or treatment. We're at that point for adults, so we don't have any plans to mandate. We continue, all of us are in here wearing masks. It's been changed, and so we tend to continue to follow the CDC. But people do have some ability to make their own decision about what they're going to do. We just continue to offer and encourage as much as we can. We want to keep things going the way they are. And from a hospital standpoint, there has been a slight increase in hospitalizations, but none of the hospitals are feeling pressure like they need to put a big hold on things yet. That's the biggest thing that we're going to be watching. That'd be the thing that would really change our minds the most. Okay?
Okay. Yeah, I have a question in relationship, and you may have already done this, I just am not aware. Have we actually gone out to assisted living facilities and nursing homes and vaccinated at those sites because those folks have less mobility?
So the state actually had responsibility for that, and they did go out through a contract with either CVS or Walgreens. They had people come in. We have done it, we've gone out on multiple occasions to different sites and done testing prior to the vaccination. And we continue with our mobile events to try and go, we've gone to a lot of different places, and if somebody from a nursing home says, we got a bunch of staff or a bunch of residents that came and haven't been vaccinated, we'll go. We have no qualms about doing that. We'll go wherever we can to give some people vaccine. So we continue to do that, but the state had actual responsibility because they fall under a state licensure that we didn't have as much control over, and that's how it was rolled out federally, actually.
Thank you.
Sure.
Do we happen to know of the new cases that we're seeing? Are these Delta?
Almost
variant?
all are Delta.
All are Delta?
Almost all are Delta. Just like every place else across the country, almost all are Delta. The good news is less than 2% of the people that are being hospitalized have how to say this? Of those that have been hospitalized, less than 2% have been vaccinated. So a very small percentage that have gotten sick, get sick to the point where they need to be hospitalized or they die. We have had 3 cases here in Nashville that had been previously vaccinated, did get the virus and did die. In all 3 cases, they had significant underlying medical problems. So, but that's like 99.999% are not being hospitalized and not dying. Versus, and about 1 per 1,000, we're seeing about a breakthrough of about 1 per 1,000. So,
And to your question, Gloria, StreetWorks and Meharry have partnered because StreetWorks has a mobile unit and they go out every Thursday, and I know that they've been hitting many of those areas as well.
Oh, great, yeah, because that's the concern, is the people that just don't have the ability
Right,
to.
to access
we
it.
actually have a service where we're actually going out and doing home vaccinations. So if somebody is identified that they're homebound, if they call the health department, we are going out and doing homebound individuals now, so.
And Walmart is offering free vaccinations too.
Yeah.
I wanted to suggest, I know you can't make the school mandate, but we can at least offer the suggestion of them having the shields as opposed to masks. That way the kids can be seen by the teacher and each other, so they'll know each other, and then they won't be so restrained with a mask, which could be somewhat smothering. But at least give some protection.
I have to say, because it was all in the paper and everything else today, I think we need to be cautious at mandating in schools. Because I don't think the state's playing right now.
And I will say from our standpoint, the school boards, they keep trying to pass that on, that they're gonna have to make that decision. We're gonna give them recommendations. And I know that they're under a lot of stress from the state, from a number of other directions, and so that's really gotta be, there's, the one thing I will say, hopefully in sometime in the next 3 to 4 months, we'll get a vaccine for those that are under 12, and we can get them vaccinated. And then truly, after we get those that can't be vaccinated right now, once we get them offered and can have long enough for them to be protected, then definitely no mandates are at that point, because people can make that decision themselves. Families can make that decision.
I'm just simply saying, I'm not at the state,
Yeah.
but I've read the paper, and I would say that it's
I know where you're
pretty
coming
real.
from, because I've heard a lot of those same
Yeah.
concerns that I actually talked to Dr. Battle just a little bit ago.
Okay.
So, yeah, we're aware.
Can I add one thing about the community events? If you go on the COVID-19 website that's on nashville.gov, there is a weekly calendar where there's going to be if you're interested.
And in addition to the website, how is that information getting, or is a significant part of our population that doesn't regularly go on computers or internet or anything? Is this being delivered like in the buses and on billboards, I mean,
Well,
places
most
where
of those
people
are,
can't
somebody's
miss it.
having an event of some kind, and they invite us to come. These folks are already planning to come to this event, whatever it is, and we go and offer the vaccination.
Okay, so there's
So it's a community-based organization or faith-based organization or something like that, who's organizing it so that we have a group that we can. So they're the
So
ones
they're
that are
kind of
asking.
reaching out. to
And
the
then they're
public.
helping coordinate with the people that are members or that they know to help get them there and all of that.
Great, because I just know that those of us who are used to, you know, we think that we've done it, but then there's so many people that that's not part of their normal life.
Right. And that's why we want to be every place that we can, because there's gonna always be somebody that doesn't have the ability the transportation, and so wherever we can be and move about the county so that we can offer that to anybody that might not have the ability to easily get to them in.
And I'll put it out the calendar largely so you guys could know. I mean, you can see if there's one coming up in your district or somebody you know or something that you might want to
And,
go to.
and likewise, if you have somebody in your district that wants to do one, just let us know.
Okay, great,
Yeah.
good deal, thank you.
Sure.
Appreciate you guys.
Thank you. Thank you. So we had a chance to hear from Dr. Gill. He'll be sharing at the council meeting as well. And so we'll be able to get to hear the numbers and the recommendations of the work that they're doing. So we're going to move right along into our agenda for this evening. RS 2021-1069 by Toombs and Taylor approves Amendment 2 to a grant from the Tennessee Department of Health and the Metro Board of Health to prepare for, respond to, and recover from COVID-19. Do I have a motion?
Second.
Been moved and seconded.
There's an existing grant, they're adding a little bit more money, $26 million worth. It's largely for testing and other COVID-related issues. We can't buy vaccines with it, we can't do vaccines with it, so we can do everything around that. It's for a 3-year grant, but they've already allocated about a little over $8 million to FY20 and FY21 to backfill some money that's a little bit more flexible that they could then use for other things. That leaves about $18 million over the next 2 years,
Okay.
and we're glad to have it.
Any further discussion? All in favor?
Aye.
Aye.
Any against? All right, great. We have a late resolution, appropriating a total of $850,000 from the general fund of the General Services District for a grant to Community Care Fellowship and authorizing a grant agreement. And there's a letter to approve from Councilmember Rosenberg. Do I have a motion?
So moved. Second.
It's been moved and properly seconded. Any discussion?
What brought this about?
But Judith, I think, can
Ms.
address
Tackett.
this.
It's really with outdoor homelessness being just a real health issue right now, and a heightened crisis after COVID. And so this is one of the things that we've piloted in a very small manner during COVID, and we feel this is going to help alleviate some of the pressure of outdoor homelessness. It's in small groups that people are being taken into existing buildings. It's a program that really focuses on getting people to housing quicker. We think that's how we speed up actually the housing process for people that are vulnerable in the outdoor community. The other thing is the prioritization. We're trying to do this in geographic areas, and there's a prioritization tool that the community that we're already using for really focusing on the most vulnerable people and offering that option to them first. It's adding another option to really speed up the housing process.
And then the follow-up on that is, why is it coming out of the GSD and not the total?
So the GSD, everybody's in the GSD,
Yeah, but.
other than the urban.
Yeah, but is it coming out of urban and general, because it just it specifies of the general services district?
The General Services District is the entire county,
I mean,
right?
I get it, but I'm just trying to understand why it specifically said that as opposed to just the budget. I was just wondering, I was just asking to see if there was any
I don't believe
differential.
that came up in Budget and Finance yesterday.
Yeah, I'm
so
sorry,
that's-
I'm
No,
sorry I
I'm
missed
just,
it.
So,
I'm just saying, yeah.
And we had a pretty lengthy conversation in this in affordable housing. That didn't come up. We can get
Okay.
that answered for you.
It's probably not a big deal. It's probably just the way it was written.
Written as a
It's just a
county.
question that I was wondering about. Thank you.
Perfect. And I've also added a late filed amendment to this. Just a few things that will happen with this, and I just wanted to share with you because I can. I've talked to Ms. Tackett about it. One is reporting, just a follow-up to the council within 90 days of the appropriation after the adoption, so starting tonight. And then secondly, it only named one location, and then it was we may see other locations. And so we wanted to kind of tighten that up just a bit. And so we have 2 additional sites that they're going to be working with, and one is going to be in Madison with City Road Chapel. So one is Brookmead, the one that was named currently in the resolution, Brookmead.
Charlotte, right?
Yes, sir. And then the second would be the Madison, partnering with City Road, and then they're also working to identify recipients and identify partners, in the southeast corridor. And so that's a late file amendment I'll be adding, so hopefully you all join me with that. Any further discussion?
Well, the one thing that I want to say, I said it yesterday in Budget and Finance. I did attend the meeting, and I've gotten quite a few emails in return where many of the residents did not feel as though that their voices have been heard. And I'm an organization that serves that homeless population as well, but I do think that we should hear what's being said by the residents when they have those concerns. And I'm really concerned about the fact that the park was not kept and maintained. And I don't like seeing the celebrations of new parks being done when we're not maintaining the old parks that we have. Are we just creating parks in order for it to look nice for that time, and we don't really take care of it? And I think there should be some inspections to ensure that the parks are maintained on a regular basis and kind of weed out the kinds of things that created this whole situation in the first place. I got to get to public safety.
Thank you. Councilman Porterfield.
Thank you, Chair. I just noticed the sponsor came in, and I didn't know if maybe he had an answer to Councilman Glover's question.
Councilmember Glover, the sponsors.
I suspect you wrote it where it says comes out of the GSD fund. It's going to come out of the total metro budget. I don't remember saying where it specifically says GSDs on others. It's just, okay. So
I don't know why, but yeah.
That's fine. That's what we figured. I just was asking the question. All right. Thank you.
Thank you. Any further discussion? All right. It's been moved and properly second. All in favor?
Aye.
Any opposed? 6 in favor, 0 against. Motion carries. And we have bills on second reading. BL 2021-834 by Taylor Gamble, Swore, Hurt, and Welsh. Davidson County by and through the Metropolitan Nashville Police Department for the purpose of ensuring the provision, integration, and coordination of behavioral health services for individuals who are mutually served by both organizations. Do we have a motion?
Move.
Have a motion, and we've been moved and properly seconded. Any discussion we have, Captain? Oh,
I believe it's cut off on the agenda. It just starts with Davidson County. So who's the second organization? It's MMPD, but who's the other organization?
Mental Health
Okay.
Co-op.
Thank you.
Sorry.
Sorry, it's not on my
Sorry.
agenda.
It's Mental Health Co-op, yes.
Okay, thank you.
Hi, good evening. David M. Hoff, I'm an inspector over the Office of Alternative Policing Strategies. This is one of the programs we're doing, which is the co-response. It's called Partners in Care. It's also our crisis intervention team. Some of you folks came out to the tour out at the Mental Health Cooperative when we were doing our training for the officers and the clinicians. We're in week 5 right now. We just completed week 5. So what we have 2 precincts, Hermitage Precinct, North Precinct. They're working Monday through Friday, the clinicians are. Monday through Friday on our first shift and our second shift. And that's from 6:30 in the morning till 3 o'clock in the afternoon is the first shift, and then 2:30 in the afternoon till 11 o'clock is our second shift. So we have a team working each one of those shifts, and the team consists of a uniformed officer who's gone through 40 hours of crisis intervention training, which is above and beyond what they've already had at the academy and our in-service training. And we have clinicians who are master's level clinicians that have either licensure or working towards licensure. They all have the ability to sign 6404 paperwork, which is committal paperwork when necessary. And they're working on 3 types of calls that they're responding to in those specific precincts during their specific times. Those are mental health calls for service, any calls involving suicidality, as well as overdose calls. And like I said, over the last, our goals of this program is to, 1, create better access to care for those experiencing a behavioral health crisis. Number 2, divert away from the criminal justice system and into the healthcare system. Improve access, coordination and communication between all those systems of care, as well as with the different service providers. And lastly, improve safety for the clinicians, the consumers we're serving, as well as the police officers that are responding to those calls. And like I said, we've gone through the last 5 weeks, gone very well. I'm open to any questions you may have.
Any discussion? Councilmember?
Just very briefly, I appreciate you coming to my office and sitting down and talking to me about it. I don't know if you guys ever listen to the radios. I don't listen to police, but I listen to fire, or I did, until it got encrypted. And this is a big issue. So I'm really glad to see you guys are doing this, and I wish you certainly all the best on it, because I hope that it will help. It astonished me the number of calls I heard that involved these types of situations. So I was grateful when you came to my office, and I'm looking forward to you guys being very successful with this.
And one thing that's important to note, it is a community partnership. It's us, DEC, we also have Public Health, Mayor's Office, Mental Health Cooperative, obviously, EMS and Fire are all involved. Public Health has hired 2 epidemiologists for this program. We're going to get a 3rd-party evaluator to evaluate it. The pilot program is going to go for 12 months, so it ends, I believe, June 30th next year. And we have data agreements between Public Health and DEC, Public Health ourselves, and Public Health and Mental Health Cooperative, and Fire and EMS, so we can get a full collection of data to evaluate the program and find out how we expand.
What would you define as successful, that said we should continue, or this was working, this isn't? How would that be, what would that look like?
Well, I think, 1, identifying those people that are in crisis, getting them assessed appropriately, getting them the care they need. Where in the past we might not have had options. We have, I know Sheriff Hall always talks about, if you have a naked person running through the woods or running through the airport, that sometimes in the past there was no options. You had to arrest, let's say. Now we don't want to do that. We want to get them the care they need, because there's really no purpose in arresting them. So once they're in crisis, we want to make sure they don't fall back into crisis. So we do plan on doing, one of the key pieces of this program is the follow-up piece. So if our team goes out there and deals with somebody in crisis, and whether it's a hospitalization or just referring them to care, that we can go check on them periodically to make sure they're okay, so they don't fall back into crisis.
Yeah.
There's also a case manager associated with the program from Mental Health Cooperative, that every contact we have, they will do a call or a personal follow-up to see how they're doing. Because they might not be getting services with Mental Health Cooperative, it might be with Centerstone or someone else, but try to do kind of an interdisciplinary teamwork process to get a hold of those service providers, check on the medication management, to make sure that if we deal with them in crisis, we get them the care they need, do the follow-up so they don't fall back into care. It's also important to note that if they do, I think there's been 27 cases in the first 4 weeks of the program in which somebody could have been arrested, criminal activity had happened, but only 7 of those cases in which they were charged. So there's 20 cases in which they were diverted to care. And in many of those times, those 7 cases dealt with, it was either state mandated by domestic violence laws or private prosecutors. So even if they do have to go to booking, if they still need care, there's still Sheriff Hall's program over at the Behavioral Care Center, where they still qualify for that as well.
Well, I'm really excited to see the unified approach between multiple agencies, because so often what we see is there's lots of good work being done, but there's duplication, because this group doesn't know that group's doing it. And in the same, we often have people fall through the cracks because I think you're doing it and you think I'm doing it. So I am really excited about this formalized cooperation and communication, so that we do not only serve the population appropriately and most successfully, but we're not wasting resources either. So this is great. Thank you.
Councilman Benedict.
Thank you, Chair. So I just want to remind, so 2 months ago during the budget process, we were able to fund this program. I think a lot of us wanted to fund the HEALS program, which is a more robust program, and what we talked about was baby steps, for lack of another term, and so I'm excited to see how this turns out. I appreciate the efforts you put into it, Inspector Imhoff. I've known you for a long time from your leadership at the East Precinct, and I just want to commend you for the program you've put together. I look forward to seeing the results, and I also look forward to seeing, hopefully, excellent results so we can build upon this and make sure that we're serving not just the 2 precincts, but everybody in the city.
Absolutely. And you make a good point about the HILS program. I've said on record that it doesn't have to be an either or. You can do both. The differences between the programs is one, this program deals with people in acute crisis, has severe acuity, that can deal with people that have weapons or show aggression. The HEALS program does not deal with those. But I think it's very much needed. And in fact, I have a meeting Thursday with the person that wrote the HEALS proposal to see what we can do to help them.
Good. Thank you.
Thank you.
Thank you.
And we'll invite you, Inspector Imhoff, back after we've gone through the program just a little bit, just to get some updates from you to see how it's working with you.
Sure.
All right. Do we have any additional discussion? All right. It's been moved and properly second. All in favor?
Aye.
Any against? Great. This meeting is adjourned. Thank you all.
Thank you, sir.
We did. It was at the beginning.
Oh, man. But I'll tell it.